Hi guys, so in today's video we'll be talking about diabetes. Are you one of those people who believe that diabetes is only caused by eating too much sugar? Well, that's not entirely true. Let's find out in this video. But before I move on, you will only appreciate this topic well enough if you know the meaning of insulin, or if you know what insulin is. Let me explain what is insulin. So insulin is a hormone that is produced by the pancreas, anyone. Its main function is to convey glucose in the blood into the cell. Is to like carry glucose in the blood into the cell where they can be used to produce energy. When we eat any food that contain carbohydrates like rice or yam, our body works on it and then processes, break it down into glucose, and then they will be released into the blood. But that's not their destination. That's not where they are needed. They are needed in the cells to produce energy. But they can only get into the cell with the help of insulin. Yes, without insulin, they can't get into the cell. If insulin is not available, or insulin is available, the body is not responding to, the cells are not responding to insulin, the glucose will remain in the blood, and then it will elevate blood sugar. That is what we see as diabetes. Two things might happen. One, insulin might not be produced at all, or it is produced in a very small quantity that cannot work effectively. Or insulin are available, like they are available, they are being produced, yeah, available and fine, but the cells are not responding to it. Let me explain that part. Now, see me as a cell. I ordered something, and then there's a delivery agent, and my product has been given to the delivery agent. See the product as the glucose in the blood. That's my product that I ordered, and I'm the cell. The product has been given to the delivery agent, and then delivery agent calls my number. I'm not picking. He came around. I'm not opening the door. I'm not responding. The problem is from me, which is the cell. That is exactly what they call insulin resistance. The insulin are available, but the cells are not responding to insulin. So now, let's talk about types of diabetes. Moving on to types of diabetes. Understanding type of diabetes should not be hard for us at all, because I've literally explained it when I was explaining insulin. Now, number one type is called type 1 diabetes. In type 1 diabetes, the cells that were supposed to produce insulin has been destroyed. Yes, so little or no insulin at all is being produced. That is either there is no insulin at all, or there is little insulin that cannot work effectively. This type of diabetes is common in young people. Number 2 type is also called type 2 diabetes. In type 2 diabetes, there is insulin available, but the cell is resistant to insulin, just like the one I used rider, cell, and product to explain. It is common in older people. And then the third type of diabetes that we have is called gestational diabetes. It is the one that occurs during pregnancy. But anyone who has gestational diabetes during pregnancy, they have the tendency of having type 2 diabetes later in life. Causes or risk factor of diabetes is being overweight, yes, inactivities like lack of exercise, you are not really walking at all, you are not really doing anything, like you don't move around and all. Family history, if there's someone in your family that had diabetes, you are at the risk of having diabetes. Certain medication too, yes, can cause diabetes. Pregnancy, I've explained that earlier. And then poor diet can also cause diabetes. Now, let's move on to symptoms of diabetes. But note that not everyone who has diabetes experience symptoms at all. Some have diabetes, but they don't experience any symptoms at all. But some will still experience some symptoms. One, frequent urination. Let me explain it. Now, if the body notices that there is more than normal glucose in the body, the kidney will try to flush it, or let's say flush it through urine. So it's going to produce more urine. But now, take note that glucose always pull water. Do you get? So when glucose is leaving the body, it pulls water along with it. So as it's pulling water, the person will urinate more. Yes, that's frequent urination. And another thing is tasting. The person will taste more. They want to drink water. Why? Because they pass out more urine. So they will be dehydrated and then they want to drink water. And then weakness or fatigue. Now, the person has energy, but the energy is not getting into the cell. Glucose, the person has glucose in their blood, but it's not getting to the cell. So the cells are starving. So the person will be weak. Any small thing, the person is weak. Any small work, they're already sweating, they're already tired because their cells are not getting energy. Blood vision. The person will not be able to see well, to be appearing blurry and all. The reason is that when glucose is too much in the body, it now gets deposited under the blood vessels in the eyes, and then it affects how they focus light. And then see, when they look at things, it appear blurry. They don't look at it where they won't be able to see it. And also slow wound healing. When they have a cut when they have a cut anywhere, it will not heal on time. Because when there is too much glucose in the blood, it will, over time, it will damage blood vessels. And then also reduce the function of white blood cells. White blood cells are responsible for healing of wound. So when their function has been reduced, it will heal, but it will be slow. And then let's move on to complications of diabetes. If someone has diabetes and then they don't take care of it on time, they don't treat it on time, what are the things that can happen? That's the meaning of complication. One, it can affect their sight. Yes, it can affect their sight. It can cause heart damage. It can cause kidney damage, liver damage. It can cause leg ulcer. Yes, when they will have leg ulcer, they can have wounds that have been with them for 3 years, 6 years. And then treatment of diabetes. Treatment of diabetes depend on the type of diabetes. Type 1 now. In type 1, there is no insulin at all, or it's not enough. So such person will be given insulin injection, yes, and some other medication just to treat type 1. And then in type 2, insulin is available, but the cell has become resistant to it. So they are going to give drugs that will increase that will make the cell to become responsive to the insulin. And then the third type, which is gestational diabetes. Often, if the woman give birth, it usually resolve itself. But if there is need for medication, your doctor will talk to you about it. But usually, after delivery, it usually resolve itself. So I hope you learned something in this video. This will be all for today's video. Bye.